Hi, good morning. I'm coming to you to tell you guys today about the importance of sleep apnea. Do you ever catch yourself falling asleep at the wheel or just dozing off in class or at work, or you cannot seem to self to stop yawning throughout the day? This can be a high indicator that you probably may be experiencing what is called sleep apnea, which are short periods of pausing of breathing while you sleep. I've done my research on this, and according to Mayo Clinic and the DMV, sleep apnea is one of the most high factors in causing motor vehicle accident. It's responsible for 25% of all motor vehicle accidents across the nation, and it kills 38,000 people annually if left untreated. Sleep apnea is, one of the leading cause, and also if it goes undetected, it can lead to more underlying conditions. So in addition to this, it's, however, not a lot of people pay attention to this, or they just think sleep apnea, they automatically think you have to be obese in order to have it, and actually that's not the case. It can just be over an enlarged neck. If you're a smoker, yes, overweight is one of the contributing factors, but not one of the main factors. Sleep apnea goes undetected with a lot of people because a lot of people just think snoring is just a natural way of life and that's just what it is. But the fact is that snoring is one of the highest indicators to have yourself get checked out. And the reason for that is because when you are sleeping at night and you are snoring, all that snoring is doing is pausing your airway to collapse down. So in your anatomy here in your neck, when you're breathing, and what sleep apnea is there's short periods of pausing through your sleeping cycle. So throughout the night, you would stop breathing a couple times, and it goes very undetected just because it just sounds normal. But when this happens, you're stopping your oxygenation from reaching your brain, causing it. So when you wake up in the morning, you feel like you just did not get enough sleep. You feel like you were just so restless, and you catch yourself dozing off throughout the day. This is one of the high indicators of that. So the way to get this, checked out, now that I've spoken to you in regards of the dangers of this, we're gonna move on just to some certain solutions. Why the importance it is to get checked out. So, for most cases, your doctor might recommend for you to get a sleep test. What a sleep test is, you can do it either at home or in an office. So the two options, if you do it in a facility, you go to a sleep center. You go in and it's like a private hotel suite. You sit down, they put a little cap on you and it has little probes all over your head. And what this does is when the respiratory therapist, when you're asleep, they're in another room, not for say watching you, but they're watching what they hooked up to you on a monitor. So they're checking your REM sleep. Your REM sleep is when you're in a deep sleep, and they'll check to see how many times a night you're actually pausing to sleep. So they'll detect how low your oxygenation goes, how often are you stopping to breathe, and that'll determine. And that's the definite with that would be an AHI level, which is an apnea hypopnea index, and that tells you how many times you stop breathing. So if that number is greater than 5, you will be diagnosed with sleep apnea. However, there's two different kinds. There's central sleep apnea and obstructive sleep apnea. Out of the two, central sleep apnea is the more dangerous one because it has to do with the brain. Obstructive sleep apnea is strictly just with the lungs. So it's just the obstructive, how it sounds in the name, obstructive sleep apnea, meaning your tongue's just rolling back, or you're just, the anatomy in your neck, whether you're big or small, is just causing your airway to collapse down, versus being like this is just collapsing down. Central sleep apnea, it's your brain not telling your heart or your lungs to continue to breathe. And that's the more dangerous one, can cause a serious stroke or heart attack. So both of those, obviously they're both dangerous, but out of the two, you would hope to just get obstructive sleep apnea. The other testing method is called a home study, which is you connect a little probe onto your finger, kind of like a pulse ox, and you have like this little monitor that's wrapped around your abdomen. And what that does is while you sleep, it just records the same way versus having all the probes on your head. This records just your rise and fall of your abdomen, and it'll record your oxygen levels throughout the night. And then you take that back to your doctor, they'll go and record the findings, and they'll go ahead and move forward from that. There are many options to treating obstructive sleep apnea depending on the levels that you do have. Um, One of them can just be it's an airway like magnet for your nasal passageway, which opens up your breathing. Um, they also have mouth guards just to keep you from having your tongue roll back. Something more clinical for say if your sleep apnea is really really bad, you might want your doctor might put you on what's called a CPAP, which is a continuous positive airway pressure device. It's a little unit about this big. It looks like a probably you guys don't know, but it looks like a little AM/FM radio. It has little knobs and it has a circuit. And depending on how bad you have it, you might require a full face mask or you might require just a nasal mask. There are full face masks that go right under the nose and over your mouth, just depending if the patient is claustrophobic or not. But what this does, and that's just like a thing, continuous positive airway pressure, what that does, depending on where your level's at on your AHIs, the doctor will have the respiratory therapist set that unit on a range. So the lowest it can go is 4 centimeters of water pressure, and it can go anywhere as high as 20 centimeters of water pressure. And what it does, it just titrates to your level. So that machine is designated to determine when you're having these episodes and push for positive airway to go in to open up your airway to keep you breathing correctly. So it's pretty neat. And then there's a different type. It's called a BiPAP, which is a little bit more, and I wouldn't say it's not invasive, but it's just a little bit severe. Like if you have really bad severe obstructive sleep apnea or central sleep apnea, you're going to be put on a BiPAP, which is the second level up. What that does, that has the inspiratory rate, the expiratory rate, and then sometimes you might have a backup rate. Like if for whatever reason it's not detecting it, it'll have a backup rate plus a pressure support that'll keep your airway open and keep it from collapsing. It's very important for you to get checked out. If you have any daytime sleepiness, it doesn't hurt just to ask, because at the end of the day, what do you have to lose? You just go in, you go home, you get to take this unit home, or you get to do it at a facility. Either way, you're sleeping. So you sleep to get diagnosed. And I'd say what's one day of, getting a good night's sleep to make sure you can save your life and treat the underlying causes. Obviously, this can cause heart attacks. It can cause strokes. It can cause aneurysms just because of the lack of oxygenation, So now that we've discussed the solutions and the treatments, I just urge you in conclusion to all this, to go ahead and get checked out. It's worse than drunk driving. Sleep driving is just the same, and like I said earlier, it causes 25% of motor vehicle accidents. Don't be part of that 25%. Get yourself checked out and stay healthy. Sleep right.